Dr. Carmona, thank you so much for joining us here in Nashville at our Innovations Behavioral Healthcare Conference.
Happy to be with you. Thanks for the opportunity.
Absolutely. One of the things in your talk this morning, which I wish our whole audience could have been in the room with you today, was talking about the correlation that you drew between the opportunity to eliminate 80% of birth defects and what we see in behavioral healthcare today as far as folks being able to pay for that up front. I was wondering if you could make some comments on that.
Yeah, I'd be happy to. There's so much of what we pay for today in healthcare that's really preventable because it's a result of our bad behaviors or not investing in prevention. So the one example I used as far as preventing birth defects, which we could prevent over 100,000 every year if women just had access to reproductive health care and prenatal care and got a multivitamin and folic acid and good nutrition, we could eliminate a lot of these. But the same goes for if we didn't smoke, we could eliminate 80% of lung cancer. If we chose healthy behaviors on a daily basis, we could eliminate maybe half of cancers. We could make significant impact on reducing cardiovascular disease. And then there's the mental health issues as well. So there's a lot of things that we can do to make our society healthier and also save a great deal of money.
Well, we thought that was such an appropriate commentary. I know that we created a social movement called Heroes in Recovery 4 years ago, and we created it once we were reflecting on the life of Betty Ford, and we were really, when we were studying her life, we were really surprised to remember that it was in 1976 that she shared her personal struggle with alcoholism, but it was 2 years prior that she shared her personal struggle with breast cancer.
Yes.
And when you look at, compare the deaths by breast cancer and the deaths by addiction, breast cancer awareness has caused those deaths to go down, whereas addiction, the deaths still continue to go up. And they call that the Betty Ford blip. And we keep waiting for our Betty Ford blip when it comes to addiction. So we thought that that was a really excellent comment that you made.
Well, there's a lot of bias in society. You know, as I pointed out, and as the audience well knows, how are we looking at this? What's the lens that we're looking at this issue of dual diagnosis, the substance abuse mental health problem? And still there are many people that believe that the war on drugs is the way to go, that this is a criminal problem. And yet we all recognize this is a health problem, and we have to become more enlightened in our approach to this problem because the war on drugs has largely failed. Whether you look at it through the judicial lens, the correctional lens, societal lens, we still have far too many problems with addiction and dual diagnosis, and it's at a cost of about $600 billion a year to our nation.
You know, Glenn Greenwald spoke at our conference in Florida last year, our Moments of Change conference, and he spoke about the book that he wrote on the Portugal experiment. I wonder if you would make some comments and enlighten our audience a little bit on that.
Yeah, the Portugal experiment was a very innovative approach where the Portuguese government just said, okay, let's see what else works. They recognized a long time ago that locking people up just wasn't making a difference. So they actually said, let's look at this differently. Instead of having these people go before a judge, let's get a social worker, let's get a psychiatrist, let's get some community activists, and they put together a team. They said, let's look at this through a whole different lens and see what are the social factors that bring this person here today for the dual diagnosis. And then they started interventions. And in fact, from that, we were able to see that dissuade a lot of people who thought, oh, we're going to create more addicts. We're not going to be tough. In fact, addiction went down. And we saw HIV go down. And we saw a lot of parameters that went down. A lot more research needs to be done to elucidate a lot of this more. But the trends that come from the Portugal experiment tells us we're on the right track. We should be looking at different ways because the straightforward war on drugs just hasn't manifested itself as we had hoped it would.
I think most lay people are surprised to learn that the largest provider of drug and mental health services in many states and communities is the criminal justice system.
Yes.
I know here in Nashville,
Yes.
the largest provider is the jail that's run by the sheriff here in Davidson
Not
County.
only that, but in many states, the largest area of growth in state government is corrections. It's building more jails, okay, hiring more correctional officers. And we have to step back, not only for drugs, but just look and say, okay, who really needs to be incarcerated? Society needs to be protected, there's no question. But is there a group of people that end up here because of a constellation of events that were out of their control, the social determinants of health and so on? And would it be far more cost effective and better to society if we figured out how to fix these problems there? You know, it's been said that it's a lot cheaper to send a young man or woman to college than it is to keep them in a prison.
Absolutely. You know, you opened up with some comments on parity legislation that's come forth. So when we take the conversation from removing the shame and stigma, we start to understand the true societal costs that we have.
Yes.
Where do you see the future for parity legislation here in this country?
Well, I've often said what I'm concerned with. I'm happy we have parity legislation, but I think the need to legislate something that should be common sense is a failure of society. Okay? Because the data tells us differently. I mean, why do I have to have an elected official pass a law to tell me to do the right thing to take care of people? Okay? But I'm happy we have it because that's what it's taken. And as Surgeon General, when I used to deal with issues, I always would try and educate first, improve the health literacy of a community, okay? And if I couldn't do it through that, then make administrative change. Last resort is legislative change because it's so complex, and then ultimately it becomes part of a partisan process. And that always isn't the best thing.
You mentioned that one of the key things that we're missing in this industry, and really as family members and loved ones of people in recovery too, was that our failure to really become activists on this issue and to get involved with our legislators and decision makers in politics. And you working in Washington, D.C. for 4 years as Surgeon General, I wonder if you could add some more commentary on that.
Yeah, I think it's very important. I mean, for all of us with foundations or as a Surgeon General is, what am I doing to try and change the dialogue around this particular issue? And so whether it's a city councilman, a board of supervisors in your community, where they have responsibility to make decisions on a local level, at the governor's office at the state level, and then nationally for our elected officials. How are we interacting through various special interest groups, NAMI, others, who to be able to bring these messages and educate the elected officials? Because let's face it, a given senator or congressperson, okay, they may be dealing with hundreds of different issues, and they have all kinds of special interest groups lobbying them every day. How are we going to differentiate the importance of what we need done as it relates to the dual diagnosis, okay? And how does that congressman who's not a health professional or senator who's not a health professional come to understand, I need to do something about this because the disease and economic burden is bearing us?
Great. Well, Dr. Carmona, thank you so much for being our keynote speaker this morning. We're just honored to have you here in Nashville.
Pleasure to be with you. Thanks very much.
Thank you.